Have an important health alert for women this morning. It has to do with brand new breast cancer screening recommendations. Women are being diagnosed with breast cancer at younger ages, and new guidelines out just this week say all women should start getting regular mammograms at age 40. Joining me live to talk about this is Dr. Lucy De La Cruz, director of the Breast Center at MedStar Georgetown University Hospital. Good morning. Thanks for talking about this important topic with us.
Hi, Marcella. Thank you for having me. And yes, definitely, it's an important topic. The U.S. Preventive Service Task Force coming out and saying, women from 40 to 74 should be having mammograms, which is a shift from their previous recommendations, which was that they should begin at 50 having biennials, meaning every other year mammograms. I would say that most of us, I'm a breast surgeon, and the American Society of Breast Surgeons has recommended women starting at the age of 40 for several years now. So it's not necessarily something that is new to our practice and to a lot of the breast radiology and the OBGYN groups, which usually are the ones that refer patients for mammograms. I am very excited that the U.S. Task Force has actually now come up and joined the other societies with these recommendations.
Talk about that a little bit more, because we're talking 10 years earlier, but you say people have pushed for this before. What is the reason that they're essentially catching up now, the guidelines?
It's interesting, they are always, we're always evidence-based. All of our societies are, but they're usually a little bit lagging. They still recommend every other year, despite the fact that all of us are doing yearly, because they feel that although screening increases the detection of breast cancer, it doesn't really, it actually leads to overtreatment and overdiagnosis. Although, to be honest, I would say that, especially in the younger women, we do get to see younger women with more aggressive cancers. And I feel, and a lot of our societies feel, that yearly mammograms is actually more appropriate for all women to have, rather than every other year. And this is based on evidence, by the way. This is not just based on historical data.
Yeah. When it comes to cancer screenings, we know it's never one size fits all, but does this also apply to women with family history or other risk factors?
So their guidelines, the U.S. Task Force did not include women with breast cancer, breasts that are dense, for example. They did not find that there was enough evidence to add additional imaging to women who have dense breasts. Now, the American Society of Breast Surgery, along with other societies, recommend that women who have dense breasts have potentially additional supplemental imaging that is decided between them and their specialist or their breast surgeon or their provider. Which is also another difference from the current recommendations that we as breast surgeons and a lot of the radiology groups and as well as the other groups recommend.
Yeah. We have just a few seconds left, but I want to ask you this. Do you feel that this new guidance goes far enough, or could we see this line moved again sometime soon?
Oh, I hope so. I hope that they do catch up to all of us. We recommend that at 25, all women should be assessed for risk assessment to see if they're considered high risk, that we start at 40, that we increase early screening in women who are considered high risk, and that we should stop screening not at 74, but when women have less than 10 years of life expectancy, because 74 is young. And that women who have dense breasts should have supplemental screening. And that's what I would say. The U.S. Task Force has made a shift, a great shift. It's still a little bit behind, and I hope that they continue to work on shifting towards meeting us all where we are right now.
All right. Such important information. Thank you so much, Dr. Lucy De La Cruz. We appreciate you being with us.
Thank you, Marcella. Have a wonderful day.
You too.